Healthcare professionals, what is a telltale sign a patient has used drugs heavily in their life? 60-year-old man who had done some drugs in life but was a heavy alcoholic. Never tells DRS of his past. Quit all by age 50. Health is falling apart by age 60. Doctor does an MRI and showing him pictures explaining the results. She turned to him and asked if he had drank heavy for years. He glares at me thinking I tattled. No. Doctor shows him the extra space in his skull around his brain. Explaining his brain had shrunk from alcohol abuse. I guess you can lie about it, but can't hide it. Redditor responds. After a blood draw I was asked if I was a heavy drinker. I absolutely was, but had my shit wired pretty tight at the time, so I asked how they knew. Guy looked me dead in the eyes and says, your red blood cells are the size of damn dinner plates. Another Redditor responds. I used to be a heavy drinker too, how the heck does it affect blood cell size? Another Redditor responds. Damn it Jim, I'm an alcoholic not a doctor. I remember doing phlebotomy rotations at a hospital in the middle of nowhere, Tennessee. Aside from the small 60-bed hospital there was nothing but farmland for miles. I met a patient with heavily scarred, twisted veins. I failed to hit a couple times but eventually found a viable one. For users can be tough sticks, but what makes me remember him to this day is the forlorn look in his eyes when he softly asked me to be careful because it was his last good one, so please don't blow it. Big ass hole in the nasal septum with no other explanation for cause. Redditor responds. I was 16 and had a doctor got angry at my deviated septum, said there was a hole burned through. He asked me how much I've insufflated drugs and I told him the truth, never. He treated me like shit even though at that point I'd never snorted anything. Only years later did I develop an appreciation for the booger sugar. Later, I found out the nasal spray I used growing up had a side effect of burning out nasal tissue. Talc retinopathy. Tiny talc particles accumulate in the retinal blood vessels of 4 drug users and can be seen during a routine eye exam. Redditor responds. Why is that? Is it something that was introduced to the body when the use needles or something? Not a doctor or scientist, just curious. Another Redditor responds. Binding agent in tablets, from people crushing up pills to inject. The talc can't go anywhere and is deposited in your tiny blood vessels all over your body, but it's easiest to see in the back of the eye. Another Redditor responds. So you're saying my eye doctor knows? The fuck? Another Redditor responds. The eyes actually give away a lot. A friend of mine developed type 1 diabetes in her early 20s, and was diagnosed by her eye doctor. Another Redditor responds. Mine told me to see a doctor because she saw high blood pressure. She was right. Another Redditor responds. Mine told me to see a doctor because she saw high blood pressure. She was right. He was smacking his mouth like a fish out of water, wearing a leather jacket in the middle of a hot Texas July. Admitted to coming down after smoking meth. Redditor responds. That first sentence is like the beginning to a western/crime novel. Another Redditor responds. He was smacking his mouth like a fish out of water, wearing a leather jacket in the middle of a hot Texas July. He didn't offer his name, and I knew better than to ask. I watched as he paced back and forth in front of my desk, regaling me with some cockamamie story of how he didn't deserve this. He was a good guy, was only trying to make some extra scratch to take care of his family. I've heard it 1,000 times before. It starts with a few drinks with friends after work, maybe betting on the ponies once a month, and it turns into a desperate man creaking my floorboards and saying that there was a note left in his kid's empty bed. It's never his fault. He just got in over his head, you see. He got caught up in the rush and bet more than he could pay. There's no way this one was a loser. He was confident. Well, when that confidence faded, they always found their way to me, begging for help. Another Redditor responds. I would genuinely read the rest of this story, would be a good book worth committing. He can hit his veins better than you. Redditor responds. As a newish RN years ago, I was working in the ER trying to get a line in for drug user. I missed twice, and after the second try she just sat up and was like, Jesus Christ, give it here, I'll do it myself. Not gonna lie, it was funny. Another Redditor responds. He was smacking his mouth like a fish out of water, wearing a leather jacket in the middle of a hot Texas July. He didn't offer his name, and I knew better than to ask. I watched as he paced back and forth in front of my desk, regaling me with some cockamamie story of how he didn't deserve this. He was a good guy, was only trying to make some extra scratch to take care of his family. I've heard it 1,000 times before. It starts with a few drinks with friends after work, maybe betting on the ponies once a month, and it turns into a desperate man creaking my floorboards and saying that there was a note left in his kid's empty bed. It's never his fault. He just got in over his head, you see. He got caught up in the rush and bet more than he could pay. There's no way this one was a loser. He was confident. Well, when that confidence faded, they always found their way to me, begging for help. Another Redditor responds. I had a guy super high on meth say that. So, my preceptor was like, fine, go ahead. It did not work. LOL. Another Redditor responds. I was an army medic, and when I offer to hit my own veins I always have to follow up with that. I don't look a Drew's user, but sometimes you can be surprised. Another Redditor responds. I mean, after watching the corpsmen in the Navy miss my veins several thousand times, I'm pretty sure I have more training than they do at this point. Another Redditor responds. It's crazy how the people you expect to be good, aren't. Different, but similar. My girlfriend is a pharmacy tech. She gave a woman a vaccine, flu, and was told she was the first person to not make it hurt, at least not more than it should. The girl had a tattoo, and she indicated she usually gets the shot in the animal's eye, toward the front of her shoulder, and my girlfriend picked a different part of the animal that matched where training said to do it, slightly back of the arm. My girlfriend said, to me, that she was shocked because the eye was too far forward and in a no-go zone. The other people who'd given this lady shots in the bird's eye were the licensed pharmacist and the Tech 4. My girlfriend is only a Tech 2 going for 3. When you give them 6 milligrams of Versed and 300 micrograms of fentanyl and they are still talking to you like normal. Redditor responds. I've had to cancel a procedure because of this. Got to 5 and 400 and they were still wide awake and could feel everything. Nursing and myself were uncomfortable at those doses and had them reschedule with anesthesia. First Redditor responds back. Yo, we have a lot of opioid abuse where I was sedating. I used diphenhydramine to potentiate and we also used Brevital, thank God. Without the Brevital it would have been a nightmare. Another Redditor responds. My buddy has a natural tolerance to opiates and DPH works wonders for him. Another Redditor responds. This is me. I don't do hard drugs, but when I was 15 I had to have my ACL repaired and woke up during surgery. Another Redditor responds. I'm not a full ginger, brown hair, red beard, but both my parents are. I'm also 6 feet 4 inches 265 with a high metabolism. I've had multiple procedures under general anesthetic, and every time in recovery, the doctor mentions how quickly I can shake off the anesthesia. My middle kid is just like this. Started to wake up in the middle of a procedure, I was allowed to watch, and the anesthesiologist turned to me and said, they're not a lightweight, are they? Most medications that cause drowsiness barely affect me, except Benadryl. I'm convinced that shit can fell an elephant. Another Redditor responds. I had a bowel obstruction caused by diverticulitis last week, was brought to the ER at a pain level 10. They gave me fentanyl for the pain and holy fuck does that work. 4 years ago when I was first diagnosed and at a pain level 8 they gave me morphine. That dropped it to a 4. I didn't realize how powerful fentanyl is, other than the news horror stories, and how much it really helps. Another Redditor responds. I got fentanyl in the ambulance after getting shocked through my faucet by lightning. It didn't touch the muscle pain in my leg, not one bit. The EMT looked a little spooked by that. Morphine didn't touch it either, but it made it so I didn't give a shit anymore. -100 out of 10, do not recommend washing dishes in a thunderstorm. Hey there. We're halfway through this video, and if you're enjoying it, I'd really appreciate it if you took just 2 seconds to hit that subscribe button. Your support means the world to me and goes a long way in helping me create more high-quality videos for you. It's damn hard to get N4 in them in our usual go-to places due to scarring of the veins. They usually tell us where we have to go because that's the only place that still works. Redditor responds. I lived with a med student who came home one day and told us about the necrotic penis she'd seen that morning from a user who had collapsed every vein he could find and had resorted to the last one. Another Redditor responds. Had a guy come to talk to us in high school about the danger of drugs. Spent an hour telling us how awesome drugs were. Finally someone asked him if they were so good, why did he stop? He said he'd collapsed every vein and all that was left was his penis or eyes and didn't fancy either option, so he went and got help to get clean. That was the most effective part of the presentation. Another Redditor responds. I've always thought that this was missing from drug education, at least when I was at school 20-ish years ago. They made drugs out to be these horrible things that you really don't want to do, but the evil addiction forces you to keep doing them. When the reality is that you get addicted to them because they feel awesome. I remember when I first dabbled in them I felt I had been lied to. I never ended up with a hard drug addiction, but I avoided things like heroin after trying other drugs on the basis that it must be absolutely amazing and too good to stop. Another Redditor responds. The message I once heard, and passed on to my kids. Don't try hard drugs, you'll like them. Another Redditor responds. The best advice I got from anyone was drugs make feeling normal boring. You enjoy everything so much more on dope, that you can't enjoy the things you like as much when you are sober. Another Redditor responds. I always found it really stark that Amy Winehouse said this the night she won a Grammy presented to her by Tony Bennett. Tony was her lifelong hero, she won a Grammy. She performed that night too. She leaned over to a friend and said something along the lines of, God, this is so boring without drugs. Arguably best night of her life but couldn't even enjoy it. So sad. If they are in recovery they will often use a lot of sugar and caffeine. If currently using they'll spend a lot of time in the bathroom. Redditor responds. Hey, I don't use drugs, but I spend a lot of time in the bathroom because of all the caffeine. Another Redditor responds. Hey, I don't use drugs, but I spend a lot of time in the bathroom because of all the caffeine. Work in anesthesia, they require 5x the meds to go sleep. Redditor responds. I required 4x the regular dose when I had my tonsils out at 16, and I still woke up during the tonsillectomy. Was not doing any drugs. Edit, no, I'm not a redhead, I'm a mousy blonde. My hair bleaches white, not yellow or orange. 0 red tones in my hair. No one in my family on either side going back 3 generations has red hair either. I had a patient once refuse the contrast dye injection as part of an MRI scan because you don't know what's in that stuff. They were there because they were having palpitations following cocaine use. Redditor responds. Man getting that dye injection. I remember the nurse telling me it was gonna feel like I'm peeing but I'm not. I remember going okay, yeah, I won't think I'm peeing. That dye went in and immediately I was like, oh shoot, I'm taking a, wait a minute. Another Redditor responds. This type of thing never fails to amaze me. I know someone who has breast implants that are outlawed in our state, gets Botox and lip injections on the reg, just started taking Ozempic and does blow weekly. She never got the COVID vaccine though because she was concerned about unknown side effects. They look 10 to 20 years older than their stated age. Redditor responds. This one is so true. Took care of a very sick pancreatitis patient in the ICU over the weekend. Dude was in his late 30s and could easily pass for late 50s. Another Redditor responds. I looked so much older at 38 than I do at 40. Alcoholism is a bitch. You can tell by the way that they are. The surprising ones are the closeted grandma/grandpas. I worked in the cath lab and an older lady's cath was negative and the doctor told her, then what caused me to have chest pain? Probably your habit, ma'am. What do you mean? The heroin. Oh. Really? She looked like your average quilting champion. Substance abuse treatment nurse here. There are the obvious signs to when someone has or is using, but I personally think about 80% of heavy drug users look like everyday normal people. These people wouldn't turn my head at the store or out on the streets. These people have jobs, have families, have lives outside of drug use. A lot of them have emotional and mental challenges that surpass any physical sign of drug use. It's usually in their charts, but if it's not, Hep C, liver failure, pancreatitis and overall health status and appearance for their age is usually a good giveaway. 10 out of 10 pain score, every time you ask. Some erratic behavior is common too. I see a lot of CKD and diabetes in chronic users or patients in recovery after a lifetime of substance abuse. I come from an area with a lot of heroin, coke and alcohol abuse. I've rarely ever had a meth addict and rarely crack users, so this applies mainly to those drugs. Redditor responds. I kinda hate the pain score questions, people will always answer differently. I suffer from cluster headaches and when the doc said how bad is the pain and I said an attack can be between 6 out of 10 to October 10th depending on the attack. And they didn't take it seriously. I then said that when I broke both the bones in my leg and had to walk on it, I only felt like that pain was a 5 or 6 out of 10. At that point they started taking what I said a lot more seriously. Another Redditor responds. When I had my C-section and needed pain medicine, they asked me to rate my pain, keeping in mind that I had been through 36 hours of the worst pain of my life off and on just prior to that. So I told them it was like a 4 to 5 when I was just sitting, but a 7 to 8 when I moved. The nurses flat out told me, it has to be a constant 7 or higher or you just get Tylenol, so do you want to try answering that again? They had to tell their patients to lie just to get the medication they really did need, and then wonder why people come to the ER calling everything a 9 or 10. Addiction knows no bounds. I work as an addiction counselor in medication-assisted treatment, methadone/Suboxone, and my clients range from homeless, barely 8th grade educated people to former doctors. That said, addicts are highly impulsive, manipulative and typically aren't the most forward-thinking people due to the nature of addiction. Redditor responds. Nearly all survivors of extreme child abuse have a history of substance abuse of some sort, whether it's alcohol or drugs or even disordered eating. The impulsiveness may be a result of extreme childhood trauma rather than drugs. When abuse survivors fix their substance abuse problems, they still face all the work to deal with the trauma that led them to take drugs in the first place. It's really hard for people like this to look ahead and see any future for themselves. They have always been made to feel utterly worthless, even by the very people who are supposed to support them the most, their parents. Happy people don't drown their pain in heroin or whatever. They are really bad to sedate, show strange behavior at some earlier or later point of their stay, withdrawal. They possibly show more obvious signs of withdrawal. They don't really like it when they get antagonized. They might try and steal meds. They mostly know perfectly fine where and how to get and started with them. ICU nurse speaking. As a fairly heavy weed smoker, I'm interested in hearing about telltale signs of that side too, compared to just hard drugs, if anyone can pitch in. Redditor responds. When I'm drilling out old fillings, I usually can smell it. Somehow it permeates composite restorations. Pretty funny. Another Redditor responds. That's funny, my nail tech says when she's filing/drilling nail beds of people who smoke weed she can smell it. Another Redditor responds. Oh my god. You've solved the question of why I'll randomly start smelling weed at the nail salon, even though no one has walked past me. As we come to the end of this video, I want to express my gratitude for your time and attention. If you've enjoyed what you've seen and want more of it, please don't forget to subscribe. Your support is what fuels this channel, and together, we can continue to grow and bring you even better content in the future. Thanks again, and until next time.